Are you able to tell us the year that MIPS CQMs sunset and eCQMs will be the mandatory reporting method?
Great question, Carrin. There is as yet no published plan or time frame set for a sunset of MIPS CQMs. Now, many people are drawing an inference from Medicare's published digital quality strategy that there will be a sunset and a complete switch to eCQMs. I think that switchover is unlikely. More likely, requirements of both methods will evolve in a converging pathway, possibly ending in a single type of measure, not completely like any of the current methods. Now, I don't think that expertise today in either eCQMs or MIPS CQMs is more likely than the other to prepare you for what measure type or types are supported 5, 10, or 20 years from now. MIPS CQMs are deeply embedded today in Medicare's quality payment program. It will not be a trivial exercise to end them. More likely, they will not end, only, as I said before, evolve. MIPS CQMs are necessary today to MVPs, and there's a 10-year ramp up planned for MVPs. Now, perusal of the MVP measure choices shows that MIPS CQMs are pivotal to the MVP infrastructure as it exists today. And there's a massive amount of work represented if we want to re-engineer MIPS CQMs to the eCQM style. Also, MIPS CQMs are required for those without EHRs. They can't use eCQMs. There is no sign that the exemptions that exist for small practices, non-patient facing practices, facility-based providers is going to go away anytime soon. And until it does, MIPS CQMs are a requirement. There's a lot of effort put into creating and maintaining specifications for these measures. The disseminated network that builds and maintains measures are still doing it more actively for MIPS CQMs than for eCQMs. There are only 42 eCQMs, and they've been fairly stable over the years, and there's 172 MIPS CQMs today that continue to dynamically change every year. It will not be a trivial matter to redirect that effort. Let's look at other changes from Medicare in our experience. Medicare announced in 2013 that claim measures would sunset. They have not yet. In 2020, Medicare announced the expected sunset of web interface reporting. Now, that is finally sunsetting, but not until several years after they initially suggested it. It will sunset in the first quarter of 2025 after we build our last web interface submissions for the 2024 performance year. Now, my advice to you is to choose what is best for you today. Change if and when you need to. Now, you should have your own digital strategy. Such a strategy will prepare you for any future that I can conceive of in quality measurement. Work on your systems, particularly digital systems, to improve the quality of your care, document your high quality care, and accurately measure and report on your high quality care. The things you learn, the skills you improve, the systems you develop will be applicable to any method of reporting that Medicare supports or demands today or in the future. Choose your reporting method based on what is available, achievable, and makes you competitive today. If you spend money on an attempt to predict Medicare's future decisions, you risk wasting time and money and risk underperforming in your quality measurement efforts. I suggest do what works and change it if and when you have to. Thanks. Good luck with your reporting.